I think the most important thing is to see it as a start, but not really a finish. When you talk about healthcare reform, you're generally talking about four main goals. One of those is affordability of health insurance. The proposals that we have now really only deal with the first one, and that's affordable health insurance. They talk about cost containment, they talk about better health care, but they really address those only at the margins. The health insurance exchanges are based on the plan that's currently being administered in Massachusetts. And the idea of the health exchanges is that they provide insurance to people who would not get insurance ordinarily. Those are the people who are individuals in the individual insurance market, and also people who are working for small businesses. So the idea with them is that they force the different plans to compete on price of the coverage. And what often can happen is that if that price of coverage is not transparent, they instead compete on varying benefits. And they use those varying benefits to attract healthier enrollees rather than the average enrollee. And then that competition breaks down. What the public option does is it is a government-run plan that competes with the private plans. And since it's a government-run plan, it can actually offer, or at least theoretically offer, coverage at a lower price. That forces the other plans to bring their prices down. We have just had a bill pass the House, and with some political issues within it. It's now going to the Senate. The big difference between the House bill plan for exchanges and the Senate proposals for the exchanges is that the House bill is a national exchange. The same exchange runs through the whole country. In the Senate proposals, each of those would be state-based exchanges. And in fact, it's possible that some states would not offer an exchange at all. If the House bill were passed today, the average American would probably have their employer would pay a greater percentage of the premiums of their health coverage. Perhaps most important, they'd also be better protected from losing their health insurance if their health care costs go up. It's also possible that it will make it easier for them to move between jobs.